Pulmonary hypertension is high blood pressure in the blood vessels that supply the lungs, the pulmonary arteries. It's a serious condition that can damage the right side of the heart. The walls of the pulmonary arteries become thick and stiff, and they cannot expand as well to allow the blood to flow. Having pulmonary arterial hypertension means that you have high blood pressure in the arteries that go from the heart to your lungs. It's different from having regular high blood pressure. With the pulmonary arterial hypertension, the tiny arteries in the lungs become narrow or blocked. Some common underlying causes of this include high blood pressure in the lungs due to some type of congenital heart disease, connective tissue disease, coronary artery disease, high blood pressure, liver disease like cirrhosis, blood clots in the lungs, and chronic lung disease like emphysema. Pulmonary hypertension cannot be cured by conventional means, but treatments can reduce your symptoms and help you manage your condition. If the cause is identified and treated early, it may be possible to prevent permanent damage to your pulmonary arteries, which are the blood vessels that supply your lungs. A positive D-dimer test result can indicate the presence of an abnormally high level of fibrin degradation. It indicates that there may be significant blood clot formation and breakdown in the body, but it doesn't tell the location or the cause. Your doctor can order a D-dimer blood test to help diagnose or to rule out the presence of pulmonary embolisms. More than 1/4 of the patients with COVID-19 had elevated D-dimer levels up to 4 months after diagnosis, according to a study published in the Journal of Thrombosis and Hemostasis. Persistent fatigue, breathlessness, and reduced exercise tolerance have been reported after acute COVID-19 infections, indicative of pulmonary hypertension. There has also been an increase in microclotting in the lungs noticed by some doctors in their patients who have recently received COVID-19 vaccines. CoQ10 plays a few critical roles in the body. For example, the body's cells need this compound to produce the energy that allows them to function. And as an antioxidant, CoQ10 also protects the cells in the body by neutralizing free radicals, which reduce oxidative stress in the body. CoQ10 supplementation improved hemoglobin and red cell maturation in patients with pulmonary arterial hypertension, which could confer clinical benefit, according to findings in a new study. The best form of CoQ10 would be ubiquinol, taken in doses of 200 to 400 milligrams per day. CoQ10, or ubiquinone, is a lipophilic molecule present in all tissues and cells that's located mainly in the inner mitochondrial membrane. It's a compound of a redox active benzoquinone ring conjugated to an isoprenoid chain. CoQ10 increases the ability of complexes 1 and 2 to transfer electrons down the mitochondrial electron transport chain, and therefore can reduce mitochondrial superoxide production. The mitochondria are responsible for generating ATP, which is the energy source of the body. Pulmonary hypertension is a heterogeneous and fatal disease of the lung vasculature, where metabolic and mitochondrial dysfunction may drive the pathogenesis. Similar to the Warburg effect in cancer, a shift from mitochondrial oxidation to glycolysis occurs in diseased pulmonary vessels and in the right ventricle. You should see my other video on mitochondria boosting supplements for more information about other supplements that can help your mitochondria. Particularly, you should check out about the research chemical SR 9009, which is one of the only things that makes the body dump damaged mitochondria and helps to generate new healthy ones. The initial diagnosis of a patient who presented with idiopathic pulmonary arterial hypertension was given an injection of a vasodilator. However, the dyspnea and the fatigue subsequently got worse. Tracing back to the family history, as well with electromyography, nerve conduction studies, and the result of muscle biopsy, mitochondrial disease was confirmed instead. After treatment with vitamin E, vitamin B2, ATP, and coenzyme Q10, the patient's condition improved. This means that pulmonary hypertension should be considered as another potential manifestation of a mitochondrial disease. Cardiac complications like pulmonary hypertension are the leading cause of death in beta thalassemia patients. L-Carnitine, due to its role in fatty acid oxidation, might help control the elevation in pulmonary artery sclerotic pressure. L-Carnitine has also been implicated in decreasing insulin resistance through mechanisms associated with the nitric oxide pathway. Evidence from epidemiological studies has shown strong correlations between insulin resistance and increased blood pressure. You could check out my videos on type 2 diabetes for many natural ways to help to reduce insulin resistance, such as berberine, cinnamon, chromium, and vanadium. Typical doses of the carnitine are up to 3 grams per day, taken in the form of L-carnitine. This can also help to boost brain power, especially when combined with nootropics and choline. You can check out my other videos on choline and racetams for more information about this. In a trial, persistent pulmonary hypertension in the newborn neonatal emergency room due to the failure to achieve normal cardiopulmonary adaptation following a delivery was investigated, and a clinical trial to assess the efficacy of magnesium sulfate in the treatment was conducted. Over a period of 2 years, 12 newborn babies admitted consecutively to the neonatal intensive care unit with severe hypoxemia due to persistent pulmonary hypertension were included in this trial. A loading dose of 200 milligrams per kg of magnesium sulfate was given over a period of 20 minutes, followed by a continuous infusion to obtain a serum magnesium level between 3.5 and 5.5 millimoles per litre. Oxygen index and alveolar arterial oxygen gradient showed significant improvements within 24 hours of treatment. In this study, magnesium sulfate was found to be safe and effective as a pulmonary vasodilator. Magnesium sulfate could be used as a first-line vasodilator in developing countries because of its low cost and its high efficacy. Parenteral magnesium sulfate is easy to administer and to monitor during treatment. When magnesium sulfate is used, systemic hypotension can also be adequately controlled with ionotropes. If you're unable to get intravenous magnesium, the next best option would be to saturate your cells with magnesium bisglycinate. You can start by slowly increasing your daily dose until side effects of stomach discomfort or diarrhea are noticed. Then reduce this dose until you're taking your maximum daily amount that does not cause any stomach discomfort. Then maintain this dose indefinitely. As magnesium is required by over 300 enzymes in the body, it can have profoundly positive benefits to many aspects of your health when taken for a few months. One of the latest studies revealing an existing correlation between vitamin K deficiency and COVID-19 severity highlights a role of vitamin K, probably via coagulation modulation. In agreement, other recent studies also indicated that anticoagulant treatments can reduce mortality in severe cases. Altogether, potential mechanisms linking COVID-19 with coagulopathy, in which vitamin K can exert its modulating role in coagulation related with disease pathogenesis, are well established. Typical doses of K2 are 100 to 300 micrograms per day. The body is unable to absorb more than 300 micrograms per day, so more than this is not necessary. The best form of K2 for absorption is menaquinone MK7. Diuretics are used to treat fluid retention due to pulmonary hypertension and to reduce hepatic congestion and peripheral edema. Moreover, diuresis can prevent a distended right ventricle from impending left ventricular filling. There's many herbal diuretics like dandelion, burdock, parsley and horsetail. However, too high a dose of diuretics or taking diuretics for too long can lead to an electrolyte imbalance, so care should be taken. The Aalborg University Hospital in Denmark examined the relationship between different levels of serum potassium and mortality among 19,549 patients with chronic heart failure. A potassium level within both the lower and the upper levels of the normal range were associated with a significant increase in the short-term risk of death. Likewise, potassium below 3.5 millimoles per litre and above 5 millimoles per litre was also associated with increased mortality. This would indicate the benefits of assessing your potassium levels and supplementing accordingly if you have pulmonary hypertension. There's also a relationship between sodium in salt increasing blood pressure and water retention, and potassium balancing out this effect and reducing the blood pressure. This would be of particular benefit in pulmonary hypertension. Also be aware that prescription diuretics, as well as herbal diuretics, can cause you to lose potassium, therefore requiring higher supplementation. Decreased availability of endothelial nitric oxide and activation of the hypoxia-inducible family of transcription factors are both consequences of vitamin C deficiency, and they're believed to be mechanisms contributing to the pathogenesis of pulmonary hypertension, and these symptoms were shown to have resolved following vitamin C supplementation. For severe cases, the best form of vitamin C would be intravenous. The next best form would be liposomal vitamin C, which you can learn to make cheaply at home in an ultrasonic cleaner. Then you have non-acidic buffered vitamin C, and finally the worst kind being a cheap acidic ascorbic acid. Vitamin C's absorption is increased when it's consumed with bioflavonoids such as quercetin, which is found in elderberry juice. Taurine is found naturally in meat, fish, dairy products and human milk, and it's also available as a dietary supplement. Research shows there's a link between higher taurine levels and significantly lower rates of death from heart disease, as well as reduced cholesterol and blood pressure. Taurine may help to reduce high blood pressure by decreasing the resistance to blood flow in your blood vessel walls. Typical doses are 1 gram taken 3 times per day. However, higher doses are sometimes taken. The herb yarrow may lower blood pressure slightly, and it could strengthen the effects of prescription drugs taken to lower blood pressure. It's used in folk medicine for the treatment of overactive cardiovascular and respiratory ailments. It has hypotensive, cardiodepressant, vasodilatory, and bronchodilatory activities. It's also known to help strengthen the arteries and to reverse and treat blood pressure problems such as varicose veins. Hawthorn is used for diseases of the heart and blood vessels, like congestive heart failure, chest pain, and irregular heartbeats. It also may be used to treat both low blood pressure and high blood pressure. It's considered by some as an adaptogenic herb for the heart, helping to normalize and strengthen its function. It's closely related to the apple tree. Therefore, the berries can not only be taken in tablet or tincture, but they can also be incorporated into many recipes, such as jam. Small daily doses of allicin, the active metabolic compound in garlic, proved to be effective in preventing a severe form of pulmonary hypertension in rats. This was according to a study reported at the Experimental Biology meeting in San Diego in 2005. You can activate the allicin in garlic by crushing it and letting it oxidize for 15 minutes before consuming it, but make sure to consume it raw. Fermented kyolic garlic also has other benefits for the heart. Vitamin D deficiency activates renin-angiotensin-aldosterone system, which affects cardiovascular system, and the activation of the renin-angiotensin-aldosterone system is also associated with pulmonary hypertension. So you want to get a 25-hydroxy vitamin D blood test and then supplement accordingly with vitamin D3 to fix any deficiency that you have. In a new study, a team of Chinese researchers discovered that polysaccharides derived from the herb astragalus might be used to improve the symptoms of pulmonary arterial hypertension. Based on the results, the research team found that treatments with astragalus polysaccharides reduced monocrotaline-induced pulmonary arterial hypertension. In addition, the treatment eliminated oxidative stress, promoted vasodilation, and reduced inflammation, all of which contribute to lowering high blood pressure. Astragalus is also investigated for its effect on life extension as a result of altering telomere lengths. Lack of oxygen causing hypoxia in pulmonary hypertension is a complication for those subjected to environmental hypoxia as a result of living at high altitude, or for those suffering from chronic hypoxic lung disease, such as chronic obstructive pulmonary disease, cystic fibrosis, or asthma. Cordyceps mushroom, Cordyceps sinensis, it can suppress the hypoxia-induced proliferation of rat pulmonary artery smooth muscle cells. For more ways to treat hypoxia, check out my other video on masks and hypoxia for some alternative solutions, such as methylene blue, vitamin B12, iron, haritaki, and other supplements. Nitric oxide is a molecule that's produced naturally by your body, and it's important for many aspects of your health. Its most important function is vasodilation, meaning that it relaxes the inner muscles of the blood vessels, causing them to widen and to increase the circulation. Nitric oxide production is essential for overall health because it allows blood, nutrients, and oxygen to travel to every part of your body effectively and efficiently. In fact, a limited capacity to produce nitric oxide is associated with heart disease, diabetes, and erectile dysfunction. Some ways to increase nitric oxide production are to consume 1 teaspoon of L-Arginine with 1 teaspoon of L-Citrulline on an empty stomach, first thing in the morning and last thing each night. This could be sweetened with stevia for taste if required. Other ways are to eat beetroot, to eat green leafy vegetables, and to take reduced glutathione.